Good afternoon, everyone. Let's get going with the numbers. Ontario numbers are stable at this time. They're 994. We've been there a couple of days now, and the average is around 1,000 or so over the last week or so. It crept up a bit from the previous week in terms of 7-day averages, but we're basically holding the line there. Deaths went up by 10. And the numbers again pushed by Toronto Public Health and GTA area numbers. Ottawa had 49 actually, and our numbers. I have to find out where we are. There we go. Hold on. Sorry about that. Thought I had the numbers here. I have them ready here. Hold on. Our numbers, anyway, are holding steady. I'm just gonna go again to our website here. Just sorry about that. I have it there, but for some reason I couldn't get it on the screen here. Just to sort of go over the numbers, we're up in terms of the average from previous day. Numbers from previous day, we're up a total of 11 cases, as you could see here, and that's 3 from Cornwall, 1 from SDNG, and 7 Prescott Russell. And so if we're looking at our rolling average, again, it puts us squarely in orange here. This is the average here. I know Cornwall's a bit up. It's down. We had a cluster of cases, so that's why it pushed the numbers up. But now we've got several days of going down. So overall, we're clearly still in the orange zone. Our other parameters of percent positivity and the R effective are still putting us in the orange zone. So I do suspect that we will stay in the orange zone moving forward until next week. As you know, every Friday the ministry makes a decision, but usually we hear from them beforehand if they're going to change us, and I do believe that we're going to stay in the orange zone. We're flat. We're right there right now. So I don't anticipate any changes. In terms of hospitalizations, we're actually at 6 hospitalizations. The update that was updated here did not include those 6, including 1 in the ICU. We have 5 outbreaks outgoing right now, and again, much lower than it was a couple of weeks ago. And have administered so far more than 9,000 vaccines, and I will talk about that a bit later and give you some updates in that regard. We will, in terms of some of the other issues, again, just go over our long-term care. Out of those homes, I can tell you that only 1, with the exception of Woodland, that had 50 positive cases and actually had an extra death. That's why we have 68 deaths there. It's still active, and that's really the one we had positive residents. It's active, with the exception of a new one, Place Rideau. There was just 1 positive resident, and all tests are negative so far. We're keeping an eye on that. And the remainder of our outbreaks really were staff. They were not residents, so that's good news there. In terms of our schools, we now have added 4 new cases in 4 separate schools in our health unit, and now we've got 15 total cases in 12 schools, and there's 1 outbreak. And that's it for the schools. So in terms of vaccinations, a few things that I want to update you on. We are updating our website accordingly, and we'll be starting to do more and more updates on the number of vaccines administered and where and so on. But I just want to give an overview of what's going on right now. We are progressing with the phase 1, which is finishing off the long-term care homes. And by the way, we have now delivered all 2 doses to all residents in long-term care, and we've delivered all first doses to retirement homes, and we've started giving second doses. There are about 28 retirement homes left. that require the second dose for the residents. And those will be done between March 14th to 18th, because that's the 28 days that we have to wait between doses. In terms of the other activities that we're doing, we're quite busy right now with multiple fixed clinics. We've had clinics all week, from last week, all weekend, including today. We've got clinics in Winchester, in Cornwall, in Hawkesbury, in Castleman, in Rockland, and in Alexandria as well. And those are for staff at long-term care or retirement homes, essential visitors, and healthcare providers in our region. Community-based physicians and so on. Our hospitals are almost finished vaccinating all their staff. So we've done a big part of phase one. Today we issued a press release talking about our plans for next week and the subsequent week. We are anticipating doing the 80-year-olds, age group certainly before the end of March, likely the week of the 14th to the 18th. We're just waiting for some vaccine supply confirmations, and we will be rolling that out as well. And we will be continuing with our vaccinations of healthcare workers, community healthcare workers, as per the ministry priority, and all the different categories and groups are on our website in terms of who goes when. Tomorrow, there will be a release of the second phase priority groups. We know what they're going to be. As a matter of fact, it's really not changed, but there's going to be some more identification of the second tier groups, which will include obviously essential workers, people less than 80 years of age, people with chronic medical conditions, and so on. And within the essential workers, there's police and fire. But although we've started with police and fire right now for the ones that are responding to medical calls, and that the essential workers include teachers and a whole slew of things. That we'll have more details on that tomorrow. There will be an announcement tomorrow regarding that. So we're getting ready, and that now coincides with not only adding AstraZeneca to the mix, which we still don't know where it's going to go. I hear there's going to be some pilot projects with it because they have limited amount next week and the following week. You're also hearing that likely tomorrow or early next week, Janssen & Janssen will be approved as well. But nevertheless, that we were on the call with the general today, and the general talked about millions of doses arriving in Ontario over the next couple of weeks. So we are going to be ramping up, and those different phases and different groups will be done simultaneously. And so I'm hoping that we can start, going through those groups, those priority groups, which are essential workers and individuals with chronic medical conditions and so on, and then we can open it up to the public. Now, in that regard, we have identified 6 mass immunization sites in our area. And they're not going to be the only sites available. Obviously, we have fixed sites as well. We're working with a hospital. They're going to be vaccinating as well. But the 6 mass immunization clinics are going to be in Cornwall, in Alexandria, in Winchester, in Castleman, in Rockland, and in Hawkesbury, those 6 areas. Most of them are going to be in arenas. We're working, as a matter of fact, today I visited the Cornwall arena, where we're looking at, we're already starting to do some clinic. We're doing our clinics there and preparing to do more mass immunization clinics. And don't forget, we will be needing a lot of space to do clinics, because as compared to when we did H1N1, for example, where we were able to put many vaccine stations in a certain space, and we were able to seat many people to wait for the vaccine and wait after the vaccine. Now we're limited. We have to have 6 feet distancing, so we need much bigger spaces to be able to accommodate a large number of people. And like I said, the arenas fit the bill for that. And that's not to say those are the only ones. We're going to have other ones around as we do different age groups, as we do different groups and priority groups moving forward. We're also going to be doing mobile clinics for people that cannot move from their home. Home care is going to be delivered at home, and so on. So those are things that are being planned as we speak. Those plans were ready, but we didn't know what the triggers were and what when the timelines would be. But I think now we're revving it up. So next month is going to be really increased acceleration of the vaccine output, not only here but across Ontario. And again, this is not even taking into account any AstraZeneca or Johnson or the Johnson vaccine. So that's good news for us. The other couple of pieces of information that have come out is that we will be able to space out the vaccines, the Moderna and the Pfizer vaccine to a 16-week period. Right now, we're spacing it out. We're spacing out the Pfizer vaccine to about 42 days. But there have been many studies now, again, with millions of people being vaccinated across the world. They've been able to ascertain that you have very high protection that persists up until about 16 weeks. So we can wait. It doesn't mean that you must wait to 16 weeks. It means that you can wait to 16 weeks. So that will give us an opportunity to, whatever we get, to give first shots to people. And then we can sort of, time it accordingly within that span of a month to 4 month waiting period between the two dosages. So that's one piece of news that came out. The other one that came out yesterday as well was the fact that with the Pfizer vaccine, now it could be frozen at less frozen temperature, so at -20 instead of -70. Again, I don't know how that's going to affect, because I don't think that a lot of people have freezers, medical grade freezers for that. But again, that may facilitate moving it from one place to another. And and freezers for -20 are probably easier to get than the -70, -80 ones. So those are the changes that we have, and obviously we're looking forward to the Johnson & Johnson vaccine, because that's a single dose vaccine. So, and that's important. I want to just quickly talk a bit about the AstraZeneca vaccine. And as you've heard, the NACI, which is National Advisory Committee of Immunization, has actually recommended to be given to individuals less than 65 years of age. I want to give a bit of a caveat there. It does not mean that this is not effective in older people. What happens is when they do the studies, they have thousands and thousands of people, but it happened that with this study that they didn't have as many people in the 65-year-old age group and above as they did in the other age groups. But although they showed efficacy in both groups, the numbers were not high enough to make them confident that it would work in 65-year-olds. I'm hearing that now, because other countries have more experience with it in that age group, that perhaps that may change. So for now, AstraZeneca is for individuals 64 or less, and will be released in pilot basis for individuals between 60 and 64 over the next couple of weeks. Again, we'd have no indication that we will be getting it. I think it's going to be done. It's going to be piloted in certain parts of Ontario. Not us. We have no indication that it will be in our area. So again, a lot of action going on. We've had a lot of questions from the media about how many doses have you given so far, and this and that. We accumulate them at the end of the day, but we're still doing clinics now, and we're going to be reporting them on a weekly basis, as we will be doing them actually on a daily basis, and then on a weekly basis we have breakdowns of where they are as well. So that's it for now, and I'm going to take some questions. Donc bonjour tout le monde. On va commencer avec les chiffres antérieurs. On est rendu en augmentation de 994 cas depuis le jour précédent. On est stable au niveau de presque 1000, ça fait quelques jours à la moyenne. On voit que toujours c'est Toronto, autour de Toronto, qui a le plus de cas. Au niveau de Ottawa, on a 49 cas. Dans notre région, je vais partager mon écran. On est rendu à plus que 2851 cas avec 147 cas actifs. On est actuellement 6 patients hospitalisés. La mise à jour va être faite demain avec une aux soins intensifs. On a ajouté un décès depuis quelques jours. Ça, c'est un autre décès d'une résidente de Woodland, la flambée. Nous avons seulement 5 flambées, je vais parler tantôt. Et nous avons vacciné plus que 9000 personnes jusqu'à date. Au niveau des changements, je pense qu'on a augmenté je pense, 11 cas. Voilà ici. Oui, on a augmenté de 11 cas. 7 Prescott Russell, 1 à SDNG et 3 à Cornwall. Et au niveau de la moyenne mobile, au niveau de la moyenne que orange ici foncé, on est toujours dans l'orange ici, malgré que Cornwall est plus élevé, mais on voit que ça baisse. C'est à cause qu'on avait quelques cas ensemble à la fois, mais on voit un trajet à la diminution, mais à la moyenne, on est dans l'orange. Et tous les autres indicateurs que nous avons au niveau de la positivité des tests et le taux de reproduction R0 qu'on appelle, nous mettent toujours dans l'orange, dans la zone orange. Donc, je pense que le ministère ne va pas changer parce qu'à chaque vendredi, ils font des changements. Je crois qu'on va rester à l'orange. D'habitude, ils nous appellent avant. Donc, j'ai eu aucun appel. Donc, je pense qu'on va rester dans l'orange. Et bien sûr, on est là avec tous les autres indicateurs, ainsi que qu'on voit ici, ainsi que le taux de positivité, etc. Au niveau des flambées, nous avons 5 qui restent. En effet, il y a juste 2 avec les résidents qui étaient positifs. En effet, celle-là, la plus importante, c'est celle-là de Woodland Villa, où on avait 50 cas de résidents positifs. 2 sont actifs actuellement et nous avons 19 employés, donc 5 sont actifs. Les restants, sauf que la dernière qu'on a, Place Rideau, il n'y a aucune résidence, c'est plutôt les employés, quelques employés, aucune autre résidence. Donc ça, c'est de bonnes nouvelles. Au niveau des écoles, nous avons ajouté 5 écoles aujourd'hui, 4 écoles de plus. Donc, nous avons 15 cas dans 12 écoles avec un flambé. Là, je vais parler un peu des vaccins. Au niveau des vaccins, je peux vous dire que ça commence à rouler, ça commence à va d'une vitesse un peu plus vite qu'avant. Il faut dire qu'on continue avec nos phase 1, avec les résidents de longue durée, les maisons de retraite, etc. Je peux vous dire que tous les résidents dans les maisons de longue durée ont reçu déjà les 2 doses de vaccins et tous les résidents de maisons de retraite ont reçu la première dose et quelques-unes commencent à recevoir la deuxième dose. En effet, entre le 14 et 18 mars, on va avoir fait les 28 qui restent des maisons de retraite, parce que ça va faire 28 jours à ce moment-là de faire les restants qui ont besoin de deuxième dose. Au niveau des processus qu'on fait actuellement, on est encore en phase 1, qui vraiment, c'est plutôt les maisons de retraite, les maisons de longue durée, ainsi les résidents, ainsi les employés aussi, et les visiteurs essentiels. Et aussi, on a commencé avec les hôpitaux, les travailleurs de la santé dans les hôpitaux et à l'extérieur aussi dans la communauté. Et nous suivons le protocole du ministère. En effet, aussi, nous avons ajouté les policiers et les pompiers qui répondent aux appels médicaux. Donc, ça va bien. On a des cliniques fixes à travers de notre région. Aujourd'hui, on a un à Cornwall, on a un autre à Castleman, on a un autre à Alexandria et Winchester, Rockland aussi, Hawkesbury, on a partout. Ça, c'est par rendez-vous seulement. Et ça, c'est pour les employés et les travailleurs de la santé qui travaillent dans les maisons de retraite, les hôpitaux, les cliniques communautaires, etc. Et aussi les policiers, les pompiers, etc. Donc, on continue avec ça. On va aller d'avance la semaine prochaine avec probablement l'arrivée de beaucoup plus de vaccins la semaine prochaine. On attend à ça. Et aussi, vous savez que bien sûr, on va recevoir, on a de nouvelles vaccins, AstraZeneca et Johnson Johnson, qui va être approuvé probablement d'ici quelques jours. Donc, ça va ajouter à nos vaccins. Et en effet, on se fait dire ce matin par le General Hillier qu'on va recevoir des millions de doses en Ontario dans quelques semaines. Donc, on aurait assez de vaccins pour aller d'avance. Aussi, il y a des nouvelles aussi avec les vaccins de Pfizer et de Moderna. On pourrait aller jusqu'à 4 mois entre la première et la deuxième dose. Ceci va on pourrait à ce moment-là vacciner beaucoup plus de personnes avec la première dose sans avoir réservé la deuxième dose. Donc, à ce moment-là, on pourrait vacciner plus du monde. Et aussi, l'autre chose c'est que au niveau des adultes, avec AstraZeneca, on sait que nous avons en effet des nouvelles que ce n'est pas recommandé en Canada pour les personnes en bas de 65 ans. Il faut expliquer que je pense, ça ne veut pas dire que ça ne marche pas aux personnes plus de 65 ans. C'est parce que quand on fait des études, il y a beaucoup de personnes qui étaient moins de 65 ans et il n'y avait pas assez de personnes pour dire avec confiance ça marche dans cette population, malgré que c'était efficace dans cette population. Apparemment, avec l'expérience qu'on a maintenant dans les pays qui utilisent pour tous les âges, on commence à voir que on a beaucoup plus de chiffres. Donc, ça se pourrait que ça change, mais pour le moment, on reste avec l'indication des personnes en bas de 65 ans. Au niveau qu'est-ce qu'on va faire prochainement? Nous allons continuer à vacciner tous les groupes de phase 1. Demain, il va y avoir une annonce ce qui va représenter les différents groupes phase 2 qui va suivre très prochainement, aussitôt qu'on reçoit assez de vaccins. Et ça va inclure les travailleurs essentiels, ça va inclure les professeurs, etc. Ça va inclure aussi les policiers, etc. Tout ça, les personnes de 75 à 80, les âges en diminuant, et bien sûr les personnes avec les maladies chroniques aussi. Donc, tous ces différents groupes vont être faits par rendez-vous dans nos plusieurs cliniques. Nous avons aussi, à un moment donné, ça va t'offrir à tout le monde qui veut le voir, qui veut avoir le vaccin, les personnes plus que 16 ans. Et à ce moment-là, on est préparé déjà. Nous avons trouvé des sites dans 6 régions, dans 6 et à ce moment-là, nous allons avoir des masses immunisations, de cliniques de masse immunisation, Cornwall, Hawkesbury, Rockland, Alexandria, Winchester, j'ai oublié un, Castleman. Il va y avoir 6. 6 avec, on va faire ça dans les arénas. Et nous allons bien sûr avoir on a d'autres cliniques déjà que nous avons actuellement. On a fait plusieurs la semaine prochaine. Aujourd'hui, samedi, on va faire d'autres aussi à travers de notre région la semaine prochaine parce que ça va augmenter ça va être prêt pour des groupes des autres groupes qui vont être ajoutés et pour qu'on puisse continuer les travailleurs de la santé, etc. Donc, on se prépare pour tout ça. On espère de commencer avec les personnes de 80 ans et plus d'ici 1-2 semaines. Nous sommes en train de préparer tout ça. La raison pour laquelle on hésite à donner une exacte date, c'est parce qu'on attend vraiment de confirmation des doses qu'on va recevoir, parce qu'à ce moment-là, on sera prêt. Déjà, nous avons fait une press release aujourd'hui qui annonce un peu qu'on va le faire à ce moment-là. Donc, moi, je crois que ça va aller même sûrement avant le fin de mars, probablement mi-mars qu'on va commencer. Et bien sûr aussi, on a des places déjà sélectionnées pour le faire. So I'm going to answer some questions that I have here and go forward. Frédéric Pépin me demande, oui, deux classes étaient, oui, isolées et fermées dans les écoles CNU-FUMI. Je le confirme. Ça fait partie des 2 des cas que nous avons trouvés à Saint-Euphémie. Je ne suis pas sûr que c'est 2 classes, mais c'est au moins une classe était isolée. Nick asks me about Walmart Cornwall outbreak. No, we have no record of that. I was asked about how many vaccines we've given. Again, we're in the process of giving them, and we'll be reporting them on a weekly basis. And we have clinics. We have 3 clinics across SDNG and 3 clinics across Prescott Russell. Should the Eastern Health Unit be back in red under the framework based on trends of the past week or so? No, at this point, I think we have all the trends that are more trending and staying as an orange, not going to yellow. MCA shared the variant of concern. Yes. The other case that I talked about variants of concern was from Akwesasne. As a matter of fact, there's more. There's 3. We did not. We wanted Akwesasne to confirm it with us, and so that's why that was the other one that we had mentioned. Have any expected shipments of vaccines not arrived? No, so far so good. But we don't know what we're going to get in weeks moving forward. And I don't know what that is. Sorry about that. Based on okay, so the other one was about retirement homes, and I explained the retirement homes, why some don't have a second dose because we're waiting for the 28 days. Sorry. For the second days and for the second dose. So that's it. I have another one. Separating children for isolation. I don't know what that is about. There are people living in our community who are in the process of immigrating to the U.S. and are awaiting their permanent resident status. In the meantime, their class, are they able to get a vaccine? They would not. Well, I don't know the answer to that. I'll get back to you on that one. Can you tell me if there's a reference guide as to how many active cases of COVID in our EOHU would then transition us to the orange zone and to the red zone? No, it's not how many active cases. It's how many. It's trends. When we go from one framework to another, it's trends between 7-day rolling average per 100,000, and looking at also hospitalization rates, looking at rate of positivity and our reproductive number, and all of those are right now trending in the orange range. I have some questions here about enforcement. Yes, we had shared some enforcement measures information about to a media outlet, and they're asking about why we didn't have any enforcement measures. My directive, particularly to our public health inspectors that were going in for regular inspections and complaint-based inspections, was to educate first. I know that the police and others have given tickets, but that we don't track those. My belief, and because we have long-standing relationships with with all of our businesses, the ones that we inspect on a regular basis, we are stressed enough, and I know that what we try to do, and we want, and that's my mantra, is education first, education and support. And again, I did not want to. It's not that we didn't have opportunity to teach, and a lot of the individuals responded to our on-site visits, and so we did not give enforcements. I mean, people were suffering enough, so I think that this is out of our respect to our community, and also in line with our education first approach. I'm ready to take some questions.
Thank you, Dr. Paul. Merci. Our first question comes from Nelson Zandbergen, Nation Valley News. Please go ahead.
Hi, Doctor.
Hi, Nelson.
I had a question. You raised someone had raised the issue of child isolation. There was a controversy in Southern Ontario. One of the health units had put out very explicitly that children who test positive, they should be isolated from their family in their room, and there's been controversy about that. What is the approach here? If a child tests positive, are they supposed to stay in their room? And
we got to be logical about it, eh? If it's a 5 to 6 year old child, you have to take care of that child. It's impossible to do that. If you're talking about a teenager or an adolescent, yes, we have protocols in place where what we talk about is, listen, if you have somebody that's positive at home and they're adults, try to use separate bathroom, try to live separately, we use separate rooms, sleep separately, eat, don't share utensils, those type of things. But if a child is 5, 6 years of age, you got to use common sense. So what we'd say to the people, wear masks, have the child wear a mask, avoid, be cautious, but you got to take care of the child. So again, it depends on the age group, Nelson.
Right. I had a question about the testing of home care workers. That issue had come up. Do they have to be tested? What's happening there?
Apparently not, and I'm looking into that. I am actually looking at that seriously. I have a meeting tomorrow morning with the LIN.
Thanks, Doctor.
Thank you.
Next question comes from Thomas Stockton, TVC 22, who asks, I spoke to MPP Amanda Smar yesterday, who said that she had spoken with Dr. Vera Etches about how to deal with those wanting to pick which vaccine they get as we start to vaccinate the wider population. Ms. Smar's position was that if given the option to choose increased the numbers of people who got vaccinated, we should do it. Do you agree with that?
I think that I need to think about that. I think that my colleagues have the right to their opinion, and I have the right to mine. The issue is that it depends on what vaccine we have, and we need to be giving vaccines as quickly as possible. So we have to balance the rapidity with which let's say we have one vaccine and one of the other. I would rather somebody take the vaccine rather than wait for the other. But
thank you.
Again, you got to balance the choice, obviously.
Thank you. Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux.
Good afternoon, Dr. Paul. Bill Kingston, Cornwall Newswatch. Can you hear me okay?
Yes, I can, Bill.
Perfect. My first question was, as far as vaccines, if I understand it correctly, you've been getting anywhere from 3 to 4 trays of Pfizer. I believe there was a shipment of Moderna that you were supposed to receive this week. Is that correct?
No, we did not receive any Moderna. We're supposed to get Moderna next week. So we have not received. So far we've received one shipment of Moderna. And it was like 250 doses. So most of the vaccine that we've been receiving, Bill, has been Pfizer. And you're right. We had 1 week that it was 4 trays, and a couple of weeks it was 3, and then before that we're getting 1 tray at a time. So I'm hoping that increases. We're supposed to be getting now monthly allocations. Right now they give it to us every week. Right now, they're going to tell us on paper, okay, every Monday or every Tuesday, you're going to get this much for the next month. So that'll help us with planning. And I'm anticipating that those numbers will be more. We're also told that there's going to be not a surprise, but an unexpected increase in the Moderna supply. So we're bracing ourselves for that as well.
Yes, speaking of the supply, so you're just going to hit the tip of the iceberg next week as far as the general population when you start to get into essential workers, people that are under 80 or have medical conditions. How do you plan out the stress of how much vaccine is being taken into arms versus what you're getting? Do you use census age data for the region to figure out how much of a load you're going to get?
Yes. We have data that we've got a sheet where it's called, we call it our clinic at a glance, and we've got all the groups, and we have the different age groups and the different numbers from our latest census data. And so, for example, we know that 80-year-olds, there's 9,200 of them, and we've vaccinated about 2,700 of them already in the retirement home and long-term care. So we have that for each of those groups as well.
Okay. Perfect. And just a clarification, if you said that you toured the Cornwall Arena, is that the Benson Center or the Civic Complex?
No, the Civic Complex. Civic Complex.
Okay. Perfect. Thank you very much.
You're welcome.
Other questions by phone? D'autres questions par téléphone? Those are all the questions for today, Dr. Paul.
Thank you. Merci.